we have researcher Yi from the Microbe Research Institute of China Academy of Science, researcher Feng Luzhao from CDC, and director physician Qi Wensheng from Guang'anmen Hospital of the China Academy of Chinese Medical Sciences to take questions on the improvement of qi and physique and immune, the proper prevention and control measures by the general public. Some pandemic information updates. In the 24 hours of April the 22nd, according to reports from provinces, cities, and Xinjiang Production Construction Corp, new confirmed cases 10, including 6 imported confirmed cases, 2 in Shanxi, in Jilin, Heilongjiang, Shanghai, Guangdong, 1 respectively. 4 were domestic cases, 3 in Heilongjiang province and 1 in Guangdong province. There was no new death. There was no new suspected case. On the day, newly cured and discharged from hospitals, 56. Close contacts removed from medical observation, 824. Severe cases were reduced by 15. On the front of imported cases, remaining confirmed imported cases 793, including 37 severe cases. Remaining suspected cases 16. Cumulatively confirmed imported cases 1,616. Cumulatively cured and discharged from hospitals 823. There was no new death case. As of 24 o'clock, April the 22nd, according to reports from provinces, cities, and Xinjiang Production Construction Corp, remaining confirmed cases 959, including 63 severe cases. Cumulatively cured and discharged from hospitals 77,207. Cumulative deaths 4,632. Cumulatively reported confirmed cases 82,798. Remaining suspected cases 20. Cumulatively traced close contacts 728,049. Close contacts who remained under medical observation 8,429. In Hubei province, there was no new confirmed case, no new nor remaining suspected cases, and no new death. Newly cured and discharged from hospitals 28. Remaining confirmed cases 69, including 2 severe cases. All the above mentioned were Wuhan cases. Cumulatively cured and discharged from hospitals 63,547, including 46,395 in Wuhan. Cumulative deaths 4,512, including 3,869 in Wuhan. Cumulatively confirmed cases 68,128, including 50,333 in Wuhan. According to reports from provinces, cities, and Xinjiang Production Construction Corp, new asymptomatic infections 27, including 1 imported asymptomatic infection. On the day, 3 were confirmed. On the day, 31 were removed from medical observation, including 7 imported asymptomatic infections. The asymptomatic infections that remained under medical observation 984, including 166 imported asymptomatic infections from Hong Kong, Macau, and Taiwan. Cumulatively reported confirmed cases 1,504, including 1,033 in the Hong Kong SAR, 45 in the Macau SAR, and 426 in the Taiwan region. On April the 22nd, remaining severe cases in Hubei was reduced to 2. National confirmed cases for the first time were brought under 1,000. Imported cases Among imported cases, more than half have been cured and discharged from hospitals, but in some spaces there is increasing risk of cluster cases. We must make up the weaknesses and the loopholes and firmly combat any revival or recurrence. Now we'd like to take questions. Please ask questions on today's topic, and please identify yourself before you ask questions. The first question is for the journalist from the first row on the left side. Thank you. With CCTV Financial Channel, soon it will be the May Day holiday. Can the general public go on tourism? Go for a travel? Will that lead to a greater risk of a cluster case? If we want to have some outdoor activities in travel, then what are the precautions that should be taken by the general public? I'd like to ask a researcher from Luzhao to take the question. Yes, indeed, May Day holiday is approaching. In the low-risk regions where there hasn't been any confirmed case, short-distance trip is safe. However, in the context that there has been some imported cases and even cluster cases, so we should keep alert. There is still risk of contracting the infection for the elder folks and pregnant women and other highly risky groups. We do not recommend short-distance travel. Prior to the travel, we suggest you should stagger your plans and avoid some crowded places. Stagger the visiting hours and avoid any recreational activities in the closed or confined spaces. If you want to go to other provinces, better seek places, choose places where there hasn't been new cases, and consult the scenic spot for their administrative measures. Prepare the masks and the hand sanitizers to be used en route. During the travel, people are recommended to have safeguards. If you are to take public transportation vehicles, you should abide by the rules. Listen to the attendants. Wear masks throughout the trip. Have a good hand hygiene. Keep the tickets well for future inquiry if possible. During your travel, or playing in the scenic spots or tourism destinations, better keep social distancing. Wear masks if there is any crowd. Have good habits and respiratory habits. If you need accommodation, select well-conditioned accommodation or hospitality services. Have your room well ventilated after the trip. If there is the symptom of dry coughs or fatigueness, better seek medical advice immediately. While you are taking transportation, public transportation vehicles, minimize the frequencies of dining. If you are to dine in a restaurant, we suggest, again, social distancing with other diners, at least 1 meter. Thank you. Next question, please. Journalist from the second row on the left side. Thank you. With the cover news, we know during the treatment and diagnosis of COVID-19, TCM has been playing an essential role. My question goes to Director Qi. What is the TCM's lens of COVID-19 and what has been its effectiveness?
The floor is given to Mr. Qi. Thank you for your question. As we know that this COVID-19, in the treatment of COVID-19, TMT played an important role in the treatment of COVID-19. We sent several batches of TMT Chinese medicine doctors, and under the leadership of academician Mr. Huang, we arrived in Wuhan in January 25th and we come back to Beijing on March 21st. We totally accept 180 patients. By March 21, among them, 140 of them have been discharged. 130 of them have received both Chinese and Western medicine treatment. And we compare our wards with other wards. For our wards, we have the lowest fatality rate, and the use of hormone is the latest within our wards. So it proves that traditional Chinese medicine is very effective. How TMT understand this COVID-19 disease? Chinese medicine have about 2,000 years of history, and we are fighting for this disease. TCM is fighting for this disease. Well, TCM believe that COVID-19 is a kind of plague. The causes of the plague is a kind of poison. The poison comes from the mouth and the nose, so it comes from the respiratory tract, and from this it enters human's body, and so there will be fever and coughing. That is the symptom of the lung, and also there will be diarrhea. So this is a symptom with the spleen. So I communicate with Western doctors also. They believe that in the early stages, the symptoms include the loss of taste and smell. So smell is related to lung, and taste is related to the spleen. So Chinese traditional medicine, TCM, believe that the two body organs that suffer from COVID-19 is the lung and the spleen. And through observation and through summary, we found out the dampness happens in the middle, and later in the middle stage, we have a fever. So if we look at the whole progress of COVID-19, we believe that dampness and lung stagnation is the core symptoms of this disease. So from this understanding, from clinical experience, we come up with an effective medicine for our patients. So that's why in our hospital, early on, the patients don't have understanding about TCM, and later they began to be very accepted to TCM, and some patients want to transfer to our wards to be treated on Chinese medicine as well. So TCM do play an important role in treatment of COVID-19. How TCM plays its role? TCM, we believe that to use medicine is just to play a war. And we don't focus on one target in TCM. TCM focuses on wholeness and part cooperation. So we believe that in the upper part of the body, we should try to prevent the dampness, and in the middle part of the body, and we should try to remove the dampness, and in the lower part of the body, we should try to reduce the deficiencies and obstructions within the body. So we try to establish positive forces within the body. And also, during the progress of the disease, at the very beginning, we try to reduce the dampness. And in the later stage, we try to reduce the fever and reduce the dampness as well. In the later part, we try to establish the positive T. And so TCM shall come up with medicines in different stages of the progress of the disease. That's our way of thinking. Thank you. Thank you. We allow further questions. On the second part, on the right side, the journalist. I'm from Hong Kong, Chinese Review newspaper, and people believe that the COVID-19 virus don't like high temperature. So now we are coming to the end of spring. Do you think that COVID-19 will be controlled because of this high temperature? Now the floor is given to Mr. Shi Yi. Thank you for your question. First, let's understand the virus itself. It is a kind of virus, coronavirus, similar to SARS, and it has a skin of the cell, and the shape of the virus is like kind of a circle, and it is sensitive to ultraviolet and to sanitizers and to alcohol as well. And with the increasing of temperature, will the virus decrease? We can try to look at this question from the spread of the virus and to the nature from the nature of the virus. And the virus have a skin cell of the skin, and it is sensitive to temperature. If the temperature increases, the virus vitality will decrease. However, we should also look at the spread of the virus. Different viruses spread differently. For example, for Ebola, it spread through close contact, and also for influenza virus, it can be spread through air. And as we know that airborne virus will be negatively influenced by temperature. That's why flu happens in spring and winter, not common in summer. We commonly believe that coronavirus spread through droplets and close contacts. So this kind of spreading, this is less influenced by temperature. In the southern hemisphere, they are in summer and fall now. The temperature is hot there, but there was cases of COVID-19 also. So we have to observe the actual happening in the summer. We'll have further questions on the right side, on the first row, the second lady journalist. Thank you. I'm from Pengpai News. Recently, there were domestic report that the U.S. restart their virus military base. That's why people living near that biological military case have to escape. And people believe that in that military base, there were the birth of the virus. And also the virus brought by militaries to Wuhan, and then this kind of virus happened in Wuhan. What's your view about this? Now the floor is given to Shi Yi. Thank you for your question. We take note that on the internet there are many news about this. In U.S., there is a doubt that the delete military biochemical research base of the virus, and the U.S. government didn't make a response, so we cannot make a judgment. So for the sourcing of the virus, this is a scientific issue. The purpose of sourcing is to prevent similar cases to happen again, to result in human losses again. So scientists of different countries are trying to identify the source of this virus. For new coronavirus, there are many different schools of thoughts. So there are different assumptions. And Chinese scientists are also carefully researching into this area to identify the source of coronavirus in an early period so as to prevent the spread of COVID-19. In the whole process of sourcing the virus beginning, this is a scientific difficulty which needs a long period of time, and there are many uncertainties in this process. So we have to compare many biological and epidemiological evidence, and we should collect those evidence.
真正完成任务。
In human history, many diseases such as HIV/AIDS or SARS, the exploration of the source took decades, or even a dozen of decades. Despite of the progress made, the research results are still based on reasoning or referring. There was not yet confirmed answer. Such research is ongoing. The pandemic COVID-19 is raging across the world. It is hoped that countries will focus on the prevention and control of COVID-19. the virus sourcing is a scientific difficulty, and it needs the joint in-depth and research by international scientists. Next question, please. Journalist from the third row on the left side. Thank you. With Hong Kong Economic Herald, we've noticed that the activity traces of confirmed cases in some places have shown the dining together with other confirmed cases. So can we still eat in restaurants? If we want to eat in restaurants, what are the safety measures we should take? Researcher Feng Luzhao will take the question. We do not recommend the gathering dining. We do not recommend dining in restaurants. Better select the very clean restaurants, make appointments in advance, avoid the peak hours, stagger the dining in restaurants. The question you've mentioned is a typical case of infection risk because of the crowding. So if you go to a restaurant to dine there, collaborate with the restaurant attendants, have your temperature monitored. And while you dine in the restaurants, make good hand hygiene. In particular, before you dine or after using toilet, wash your hands. Try to maintain a good social distance with other diners. Pay attention to the respiratory ceremony. Use a separate plate dining to avoid the risk of contamination. Thank you. Next question is for journalist on the third row on the right side, please. With the CCTV. Just now, researcher Shi Yi has talked about the feature of the COVID-19, but we are very much concerned. When will this end? Some scientists say and are concerned that it will come back every winter, and some say it will become a commonly seen disease. So what is the expert's view? I'd like to ask researcher Shi to take the question. Thank you for your question. As to when the pandemic will end, in light of the current context, China has made enormous efforts and have effectively curbed its domestic transmission. However, by looking at the world situation, it's hard to say that the pandemic can end within a short foreseeable future. Will COVID-19 become a routine and a regular virus? Some experts say the likelihood is there, but the likelihood is not high. Influenza is highly mutative. Like population or herd immunity may develop for this year's influenza virus, but next year influenza virus may develop new strain and will embark on the new route of transmission. However, COVID-19 is not highly mutative like influenza virus, so we do not see a high likelihood of COVID-19 to become a regular coming back influenza virus. For coronaviruses have already become seasonal prevalent virus. As a member of a coronavirus family, there is the likelihood, but it is still up to man and humankind to make efforts. The success in the development of COVID-19 vaccine will help the mankind to achieve the final win against the COVID-19. As to whether it may become a chronic disease, according to experts' analysis based on the current research and the clinical practices, the coronavirus COVID-19 is replicated in the respiratory tracts, so it's difficult to be chronically carried. The SARS virus and the MERS coronavirus were the past examples, and we didn't see the infected carrying the virus for longer time or as chronically. And in the rehabilitated patients from COVID-19, we do not see the long-term carriage of the virus. So we believe the likelihood of the sustained carrying of the virus is very low, and we do not have immune study results to support the long-term carriage of the virus. Mankind's understanding of COVID-19 is deepening as time elapses. Down the road, we'll continue to promote science and research. On one hand, we will continuously step up the monitoring of COVID-19 and look further into its nature and transmission pattern, watch closely its mutation over time. On the other hand, we will proactively research on the vaccine and effective medicines so as to provide strong support for the ultimate solution. Next question, please. Journalist from the fourth row on the left side, please. Thank you. With Red Star News. TCM emphasizes that if you have the positive qi, then the evil qi will not be able to invade you. What are the measures adopted by TCM to improve the positive qi? I'd like to ask Qi Wensheng to take the question. Yes, it is a very classical saying in TCM. The common understanding is that once the positive qi is energetic, then all the organs will function very energetically, and the evil qi will not invade. But it is only half the story. When we say if you have the positive qi, we are not saying that your positive qi is very strong. TCM emphasizes balance. Therefore, there should be the balance of qi and vital energy. The strength and the balance of qi are both important, and in TCM's lens, the balance is more important. So, for patients, if you take medicines to improve the qi, it has to be dependent on the specific condition of an individual. Many may take ginseng or the Scutellaria. It may not be because for those who not the qi or the qi is much stronger, and people as such do not need such infeed of the positive qi stuff. Immune need to be regulated. And if you have certain inflammation, then you have to get rid of the inflammation. In other words, your positive qi is too strong, and you have to get rid of it to ensure the balance. TCM emphasizes the balance between yin and yang. And to realize that, TCM emphasizes the following aspects. First, live according to season. Your lifestyle should be accommodated with the season that you are living in. Ensure good diet, ensure good sleep, and also wear clothes according to the season. Second, you should have good emotional health. The change in your emotion will influence your immune. That's why TCM emphasizes that the peace of mind is important for a healthy immune.
Hazard is a good diet. A good diet means a balanced diet. We should not overly focus on one kind of food. In summer, and in winter, you should pay attention to eat less fatty food and to eat nutritious food as well. And also, after taking good habits, if you still don't feel well, for example, if you have some inflammation and it's difficult for you to have a stool, so you can use some TCM to make some adjustment of your body. In preventing disease, TCM have such an understanding. In preventing infectious disease, we focus on our immune system because there are three factors for the infectious disease to happen. One is the pathogen, the second is the transmission, the third is sensitive people. And so we focus on improving people's immune system. So if you have a positive T within your body, if your immune system is strong, you will not get infected. So you can adjust your sleep, your mood, and your diet. If you cannot achieve balance through this, you can take some Chinese medicine. Thank you. We allow further questions. On the right side, the fourth row, the first journalist near the aisle. Thank you, Chair. I'm from CGTN. Just now, Mr. Shi Yi talked about that the COVID-19 epidemic cannot be stopped within a short period of time. So without a successful vaccine, what is the best way to prevent such a disease? Now, the floor is given back to Mr. Shi Yi again. Thank you for your question. Just now, I've said that for COVID-19, this is a new virus for us. For average person, our immune system do not have antibody against this virus. So when virus come to people's body, the immune system will take action and to come up with a protective antibody and also come up with immune memory. Without the successful launch of a vaccine, before the successful launch of the vaccine and to fight against COVID-19, we try to have hygiene standards, that is to protect those vulnerable groups and try to stop spreading. And you should have a high hygiene and wear mask. For those infected patients, we should have early finding, early identification, and early separation, and early hospitalization. In this way, we can stop transmission and spreading. We are continuously carrying out scientific research into the virus, try to understand the origin, the spreading of the virus, and also the pathology, and also how the virus mutate. And we are trying to research into the vaccines and the therapies as well. The accumulation of knowledge and technology can help us to prevent and cure the disease further. At the same time, based on our Institute of Microbiology, we set up a literature sharing platform for COVID-19. This platform have collected articles about COVID-19, and we also INA information and other informations about the virus. This sharing platform is very open and provides a lot of services. It signifies important success made in spreading information about COVID-19. Thank you. We allow for one final question. On the right side, the fourth row, the third journalist. Thank you. I'm from Daily Economic News. Now, different universities have declared the opening date of their school, and how should the students come back to their school, and how should they have a better, healthy life on campus? Thank you for your question. Now, Feng Zhao have the floor, and students should abide by the school's arrangements to come back to the school. If they need to take a long trip to come back to the school, they have to wear a mask and have hand sanitizers. When they take public transportation, according to the train attendants' arrangement, they should wear a mask and keep their tickets and have their temperature monitored through this journey. And also, when they arrive at the school, they should follow the school's arrangement to have their health monitored. And the students should learn information and knowledge about the COVID-19 prevention, take precaution measures as well. When school is opened, when class starts, before they enter the classroom, temperature should be taken, mask should be worn, and between two seats there should be at least 1 meter, and the number of hours within the classroom should be limited, and they should not crowd into one group. And also within the dormitory, we should avoid clouding, and we should wear mask within a dormitory, and you should not go to another dormitory. And if you suffer from a fever, dry cough, sniffing, if you have some similar symptoms, you should report to the school and come to the hospital. And also for catering, you should take your own knives and forks and sticks and your own kitchen essentials before you came to the kitchen. And also we should have a staggered plan for students to come to the kitchen. Thank you. Now we have several guests today showing us how can we prevent COVID-19, and these are very practical information. Tomorrow we will have a press conference on strengthening the help of rural poor people, and we will invite in State Council Poverty Alleviation Bureau to answer the questions of the journalists. And that's the end of this press conference. Thank you.